right, welcome back to Rohrich Knows Podcast, helping you become a better you. The lips have it. They always have. The key is when to do them, when to not do them, and when to not ever overdo them. So let's talk about the 5 things that you can do with your lips, the 5 L's. Okay, we'll start from the simple things. A lip liner. Well, all of you know that liner helps to define the shape of the lips and gives you a more precise, fuller look. And it prevents lipstick from bleeding. And it helps gives you that natural look that you can see here. And a lip liner applied well looks amazing. It truly does. And then sometimes a lip liner along with a very carefully done lip tattoo looks remarkable and is long lasting. So lip liner is critical. And it gives you that pout. Now, one thing that's become very popular with a lip liner is a lip plumper. These are cosmetic products that temporarily enhance the fullness of the lips, and they often can contain ingredients that can cause a mild swelling effect, resulting in plumper lips. And you can see that's fairly dramatic in this area. And you can see in the before and after here that this is very, very rejuvenative. Of course, it's temporary. But these are very good and safe things to do, especially in the young lip that just needs some nourishment. I think that's really fantastic. Now we're going from that to the third one, which is a lip filler. Now, lip fillers are injectable treatments, and I would refer you back to the 5 key steps in doing an ideal lip filler from a recent YouTube that I did just to show you how to do it with finesse for the volume and shape of the lips and the commissure. And these typically are hyaluronic acid-based fillers that can last several months to a year. In fact, if anything, they last a long time. They certainly can last a lot longer than you think. So how do you know when to do it and when not to do it? The key is, remember, the proportions is that your upper lip should never be bigger than your lower lip, okay? That doesn't look natural. So, and you want to not look done and certainly not overdone. You just want to look natural. If anything, when I see a patient for a lip filler for the first time, I talk to him about the pros and cons, and of course I talk to him about what areas I think are the most important, and that's the commissures. If you have downturning commissures, those are the most important things to fill first and foremost. And then it's the bleed lines on the upper and lower lip areas, the philtral columns, number 3, and then the plumping areas above the cupid's bow, and then the plumping areas in the lower lip. Those are the 5 different areas you want to treat minimally with a hyaluronic acid filler. And I think that can be your choice. So the beautiful thing about a lip filler is that it really, really can accentuate a lip and can work well with a lip liner, as you can see here. And it doesn't require a lot of volume, a cc or less. And look how you can fill in the commissures as well. That's very, very powerful. And it looks very natural. And I think that really comes and is striking. And this is also another good example of a well-done lip filler, because you've filled in the commissure areas and you've also blended the lateral commissure and the lateral upper and lower lips and give them a natural look. Not an overdone, pouted look, but a natural look. And I think that cannot be overemphasized. And so you can see that kind of look. And I think, honestly, sometimes it may look a little bit overdone, like the one on the right, but the key is don't overdo it. Don't let that enter the room before your eyes. Because when you look at somebody, you always look at their eyes, their nose, and their lips. And they should be in harmony. And that's the beauty of doing a well-done rhinoplasty, is that it then focuses the entire face on your eyes and then the lips. So the lips have to look inspiring and aspirational, not the, oh my goodness, what did you do look. Okay? And so then you can go from this type of look to perhaps something that's probably a little bit overdone, And I think, again, the upper lip should not be bigger than the lower lip. And again, this also speaks of the duck lip. And basically, when this is really a technique where you overdid the vermilion cutaneous border, and that is not a good look. And how you fix it is that you just have to melt all that out. You have to melt it, wait a few weeks, and then come back and start all over. It's kind of like starting with a new painting. If the painting's bad, you've got to get rid of the base and then start with the canvas. And so this is not the look you want. And certainly not these types of looks. And of course, they look painful. And I will tell you, it's a real challenge when I see patients like this, because sometimes, it's more than the filler. The fillers are not necessarily going to be able to be melted away, because sometimes, especially if they've been done in other countries, they may be fillers that are not, that you can't melt away. They may be permanent fillers, silicone or some other hydrogels that are not absorbable, and that's a tragedy. And I recently did a silicone implant, silicone filler removal in a lady that had significant filler done 15 years ago, and you have to serially excise their foreign body, which really is what it is, in their upper and lower lip, without deforming it. It takes 2-3 procedures. So that's a very, very powerful thing to consider. Less is more. Know the anatomy, know the aesthetics, and just do non or biodegradable hyaluronic acid fillers. The lip flip. Well, the lip flip is really the use of a neuromodulator like Botox to enhance the patient's upper lip and lower lip appearance. I usually just inject the upper or the lower lip. I don't do both, because then they may have trouble sucking on a straw or things like that. But it's a very powerful thing to do at the end of doing lip filler. And they're injected in the superficial portion of the orbicularis. There's usually 2 little pokes in the upper lip, just outside the vermilion cutaneous border. Couple of units of Botox in these areas, and it just helps to flip that upper lip softly. It's beautiful. And it works very, very nicely in these, 1 or 2 units in each area, and it helps to give you a nice puckered, soft look. And I do that all the time when I'm doing full face Botoxes. And it just helps soften, especially if they have a very, very short upper lip, and it helps to flip that part of the muscle and give you a nice look. The last thing I'm going to talk about is perhaps the most overdone procedure in modern facial rejuvenation. That's called a lip lift. And it is a surgical procedure. And it's one that shortens the space between the nose and the top of the lip. And it can improve the shape and increase the amount of mucosa. And it can result in a fuller look if it's done for patients that need it. Specifically, if, like this lady, had a long aging lip that was really had atrophy. In other words, had loss of plumpness. So just doing an excision of the skin below the lip, below the vermilion cutaneous border, from the lower part of the alar base and the upper lip at the junction with the nose, you can make a very powerful change here. And so when is it indicated? I think it's indicated in the aging patient, and the patient that has a long filtral column, so when they smile, you can't hardly see their teeth. That's when a lip lift is indicated. Not in a young patient that's had filler done, because that's when it looks terrible. This is an ideal patient to do that on. She's a beautiful woman that has an aging central upper lip and just a small amount of central upper lip lift was very powerful in giving her a permanent, beautiful, puckered upper-lower lip relationship. Beautiful, nice lip shape and contour, very subtle, very nice. So this procedure can be done in the office. Often I do it in the operating room in conjunction with a facelift, and it is a very powerful procedure. Never overdo this. Never overdo this. Less is more. And there's a lot that I've talked about and written about in doing this technique. So I won't go into it, but you can certainly read about it in some of the articles that I've written in our Journal of Plastic and Reconstructive Surgery. And this just shows you that some of the general lines. They're hidden between the alar bases, just in that shadow below the nostrils and the columella in that area. And it can be beautiful. You can see it's almost imperceptible when it's done correctly, and you shape it and you close it correctly. And obviously, in a patient like this, I think this may be slightly overdone, because that distance should be at least 13 millimeters from the central vermilion, central portion of the upper vermilion to the columella. Because if you see so much of the lip show in repose, then I think you have not done that patient a service. So these are the 5 techniques and 5 technologies that I think really bear talking about, because you can do so much with your lips, from shaping it to lining it to plumping it to flipping it to lifting it. These 5 things can be dramatic in improving your facial appearance, and they can do so much to actually allow you to look and be the best you can be. But do it in the hands of someone that really is an expert in facial aging, especially with lip lifts. Don't be doing lip lifts in patients that are 20 or 30 that have short lips to begin with. They need other things, or sometimes they don't need anything at all. And those can be irreversible. So know before you go. And find a board-certified plastic surgeon or facial plastic surgeon that really understands the art of lip shaping, lip surgery, and it can be a game changer and life changer for you. So give me your comments, give me your thoughts, and helping you become a better you. Until next time, stay safe.